Good afternoon, everyone. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and Saskatchewan's Chief Medical Health Officer, Dr. Shahab. And joining us on the line is SHA CEO Scott Livingston. Both Premier Moe and Dr. Shahab will have some remarks, and then we will have time for questions.
Well, thank you very much. Good afternoon, everyone. I appreciate you joining us here today. As you know, the current set of public health orders is in place until this Friday, January the 15th. Today, on the recommendation of Dr. Shahab and his team, we are extending those public health orders for 2 additional weeks until Friday, January the 29th. These include private indoor gatherings will remain limited to immediate household members only, with some very limited exceptions for individuals that may be living alone, caregivers, or support services. Private outdoor gatherings can be up to 10 people, provided physical distancing can be maintained. Most retail locations and personal services are operating at a reduced capacity of 50%, and large retail locations are reduced to 25% capacity. Restaurants continue to be limited to 4 customers per table and 3 meters between tables for in-person dining, and our places of worship, our concert venues, and theaters remain limited at 30 people. Prior to Christmas, we did see these measures starting to have a positive effect in lowering our case numbers in Saskatchewan. However, since Christmas and New Year's, we have seen the case numbers on the rise again. And that's why these restrictions are being extended for at least an additional 2 weeks. They will have to be reevaluated at that point in time and either extended or revised based on what the case numbers will show at that point in time. Our vaccination program in Saskatchewan continues to progress. Yes, there's been some questions about the pace of vaccinations in Saskatchewan and whether they should be going faster. The answer is yes, they should be going faster. We made some policy decisions in the early days of the vaccination program that resulted in our pace of vaccination delivery being slightly lower than in some other areas. And we'll be doing things slightly different as we move forward, and that is going to speed up the pace of vaccinations for Saskatchewan residents. For the Pfizer pilot project, we decided to withhold the second doses of that vaccine. We're no longer doing that with Pfizer deliveries that are coming in now. Instead, we are administering all of the doses we receive as soon as we receive them. That will be the case with this week's shipment of 6,825 Pfizer doses that are being shipped into Saskatoon. We also made a decision to send a significant portion of our first batch of Moderna vaccines to the most rural and remote areas of our province. And I think there was good reason to do that, as some of our remote northern communities have experienced some of the highest rates of transmission in Saskatchewan. However, vaccinating in many of our rural and remote northern areas is just by its nature going to take slightly longer than vaccinating in many of our more populated areas. We're going to continue to send some of our Moderna vaccines to the far north, but our next shipment of 5,400 Moderna vaccines that will be expected this week will also be distributed to over 50 communities in the southeast and east central regions of the province, which will allow it to be administered very quickly. It'll be sent out to Kenora, Kamsack, Kelvington, Wadena, and surrounding communities in the east central area, and Weyburn and a number of surrounding communities in the southeast. Finally, the initial guidance from Pfizer was that once a shipment arrived at its primary location, it needed to be administered at that site and not moved again. That guidance has now changed. Pfizer vaccines can now be moved and administered at secondary locations, and this will be very helpful. This means that Pfizer vaccines that we're receiving in Regina, in Saskatoon, and in Prince Albert can then be moved to long-term care facilities and personal care homes to be administered on site. They'll be administered to the staff and the residents in the coming days. We do need to pick up the pace of our vaccinations here in Saskatchewan, and we will. These 3 changes will allow our healthcare workers to get more Saskatchewan residents vaccinated more quickly in the days and weeks ahead. Of course, it's still going to take some time until everyone can receive their vaccination here. The federal government has said that Saskatchewan can expect to receive about 190,000 Pfizer and Moderna vaccines by the end of the first quarter in 2021. And while that may sound like a large number of vaccines, we need to remember that these are 2-shot or 2-dose vaccines. So that's enough to do about 95,000 Saskatchewan residents. It's about 8% of our population that could be fully vaccinated with the current allotment in the first quarter of 2021. And that's why we would still like to, and are working closely with the federal government and other provinces, to access more vaccines and to access them more quickly. Some good news on that front this morning with the Prime Minister announcing that they have procured an additional 20 million doses from Pfizer, and I don't know that we are going to see those additional doses in the first quarter of 2021, but we should start to see more doses sometime in the spring. As we sit here in this province, the threat of COVID transmission remains high. In fairness, it remains high across the nation. So until we have a significant portion of our population that is fully vaccinated, we need everyone to keep following the public health advice, the public health orders and guidelines that are in place. They include staying home if you are feeling unwell, avoid large gatherings, wear a mask when required, continue to wash your hands, and continue to physically distance where you can. COVID-19, as we know, is highly contagious. It is dangerous, and it is a deadly disease. And I would like to, at this point in time, express my condolences to everyone who has lost a loved one over the course of the past few weeks due to COVID-19. And once again, I want to take this opportunity to thank the people of this great province for everything that you are doing to keep yourself, to keep your family, and to keep your community members safe. Thank you, and Dr. Shahab.
Thank you, Premier. So I'll maybe start by also expressing my condolences. We have had since January 1st, 49 Saskatchewan residents who have passed away. And this number is far too high, and it is a direct result of our high community transmission rates. And that's why we must do all we can to minimize COVID transmission in our communities while the vaccination program picks up. So while we're continuing with our current public health orders, it's important to recognize that the same orders brought our numbers down in mid-December. So even before we enter into the holidays and the pre-season rush for shopping, the way people are going around was that, going around in a more thoughtful way when going shopping, maybe just one person from a household. If people were choosing to go to a bar or restaurant, going at times when it's less crowded, following all the guidelines, and of course gatherings between households did not continue over the holidays, and we saw numbers dip further. Now some of that dip was also due to a decrease in testing. So over the last couple of weeks we have seen three things. We've seen our testing numbers come up, which is good. We have seen our case numbers rise, which is concerning. In fact, last 4 or 5 days have been very concerning. 3 days with 300, 1 day with 400, and 250 today. And so 250 also is very high, but compared to the last 4 days, it looks, almost you have a sense of relief. But again, even 250 is too high. And when we analyze these numbers, what we see is there were unfortunately gatherings that happened that resulted in transmissions between households, and the modeling had predicted that even if 10% of household members don't comply with the orders, we will see the spike that we are seeing. And while most public places are complying with the guidelines, both the business owners and the patrons, we have now issued warning letters and fines to several bars, for example, where the business owners are not complying with the guidelines, the patrons are not complying, there's mingling among tables, that's resulting in outbreaks. So again, I think we have to recognize that unless all of us pull together, COVID comes back with a vengeance, and that's what we are seeing right now. So unless we can again collectively return to our very cautious behaviors that allowed us to do so many things that we saw in mid-December, we will not be able to reverse this trend. And then, unfortunately, we would have to recommend, several measures that could be quite significant. And again, when you talk about lockdowns or closures for entire sectors, the majority of those sectors are in good compliance with minimum transmission, and it's only a few businesses or patrons in those businesses that kind of, cause a focus on specific sectors, whether it's bars or restaurants or other public settings. Same with household gatherings. Over the holidays, all of us saw people were not meeting between households. The weather was mild. People are meeting outdoors. The weather continues to be mild. So again, it's a great opportunity to keep taking advantage of the outdoors. But unfortunately, we're seeing importation to schools, because certain households decided to have large gatherings. We're seeing implications to workplaces, and I think we really have to course correct this week and see a decline in case numbers the next week. Otherwise, we could be in a critical situation. Our case numbers, 7-day average, are second highest right now in Canada. Active case numbers, depending on which website you go to, are we're tied with the highest in Canada with another province. So again, I think we have to be very cautious now, even more so than we were in mid-December. But with our collective actions, we can turn this around without having to go into a significant lockdown. But it requires all of us to take that collective action. Thank you.
Thank you, Premier. Thank you, Doctor. We will now take questions, and we'll start here in the room. Lynn?
With today being this highest 7-day average we've seen so far, how concerning is that to you to see such a high number? And then are you actually confident that just extending current restrictions will be enough to combat that?
So I'm in daily communications with my colleagues throughout Saskatchewan, and I think we're seeing what I just described. We're seeing the outcomes of primarily gatherings that happened over the holidays. But then what do we do with high case numbers going forwards? Again, I think everything needs to slow down a bit. So what it means is, like in northern Saskatchewan, my colleagues are working with community leaders to minimize interactions between households. Even small gatherings outside among young people where you're not maintaining a physical distance, where you're passing things around, for example, can be problematic. So that's resulting in transmission. Similarly, over the rest of Saskatchewan, we have high case numbers in the north and far north, much higher. But Regina and Saskatoon, moderate case numbers. South in general has been of concern, but not as high as the north and far north. And there again, everything we were doing in mid-December with the same guidelines in place was kind of bending the curve downwards. And I think all of us need to revisit those behaviors throughout the province. But there may be some specific measures that may be required locally in communities in the north and far north, which the local medical health officers will be discussing with the leaders, and also messaging into the community. Because again, the weather is great. It's a great time to spend time outdoors when you can. But it is those gatherings inside the home that can be challenging. And we have to remember that if the weather turns and it becomes extremely cold, then we could see an even further jump, which we really have to prevent.
Follow-up?
That doesn't quite answer my first question. Even when we did see that little bit of a dip from the restrictions in December, you were still saying we're still plateauing pretty high. Why not bring in further measures to see that drop even further?
Yeah, so in December, we were seeing a plateauing and a certain downward trend. Over the holidays, we saw a much significant downward trend, but we don't believe that was telling us the true picture because the testing numbers were also down. So, but we had to then see what would happen in January. So if we had seen a continuation of that downward trend in the first 2 weeks of January, in fact, we could have looked at even relaxing some of the measures in place. But actually that has not been seen. We've seen an increase, and part of it was predictable. It's happened in almost every other province between BC and Quebec, that we're seeing the bit of a rebound from the Christmas holidays in settings where people did not comply with the public health orders. But then we have another 2 weeks, I think, with the current measures in place. But we need universal compliance to see if this can turn around. Otherwise, the other options that remain beyond the current public health measures are, we can see that in being enacted in many other jurisdictions across Canada that are quite stringent. But this can be turned around by universal compliance by all of us, which actually did happen in December. We were on an upward trajectory. It leveled off with the same measures that we have in place now.
I'd maybe just add a couple of items to that. To further the restrictions and the measures that we have in place today, which are significant, there's consequences to that as well. There's consequences to individuals in our communities across the province when it comes to mental health. There's consequences to our youth, their access to recreation opportunities. And I'd just say that the measures that are in place are not insignificant by any stretch. Yes, there's some areas of the nation that may have additional measures in place, but most certainly the measures in place in Saskatchewan are not insignificant in any way. and they did work throughout the December. Our 7-day average on new cases throughout December was declining through the bulk of the month. Yes, in January, that has started to increase as we see this post-holiday or post-Christmas bump, which we had talked about publicly in the lead up to Christmas, and ultimately we are seeing here today. That is why I think you've seen Dr. Shahab recommend to continue with the already significant restrictions or measures that are in place for the next 2 weeks to see if we're able to have success by the end of that 2 weeks, like we did throughout the month of January. And if we're not able to start to bend this trajectory down by the end of January, Dr. Shahab may have some more difficult decisions to make. If we are able to start to bend that trajectory down, that would be a positive thing, and we're very hopeful that we'll see results like we did throughout January with the very same set of measures in place here today post the holiday season. I would just add, I had an opportunity to spend a couple of weeks in my home community and talk to a number of people, and I think it's fair to say that all of us in this province are experiencing, including myself, a certain level of COVID fatigue. We just came through a holiday season where we had asked Saskatchewan people to do to perform a significant sacrifice in sticking to their own household, keeping their outdoor gatherings to a minimum. We're fortunate through that season to have some very advantageous Saskatchewan weather, and I hope people were able to get outside and enjoy the weather and enjoy some of the people that they were able to see. But this, again, now we are seeing this bump in numbers, and we have to ask people to, although they may be fatigued with the COVID measures that are in place, we need them to adhere to them just a little bit longer until we can ensure that we have access to the majority of Saskatchewan people with this vaccine. So we have some weeks and likely a couple of months ahead of us.
We'll take another question in the room. Adam?
Have you thought about shutting down businesses or closing them that aren't following the rules rather than sending warning letters to places? It's been a while since we've known these restrictions are in place, and if they're contributing to super spreader events, why not send a message that way, because other provinces aren't even allowing those places to be open right now.
I would just very quickly say where there are businesses, whatever they might be, that are acting in a fashion that is out of compliance with the public health orders, there's a public health investigation that will occur, and if they are found to be out of compliance, they will be fined, as will individuals that may be participating in this. This is a point for us all to just maybe reflect on where we are. We have our kids that in some cases are participating in distance learning. They aren't in the classroom in some areas of the province. We have kids that aren't able to participate fully in the recreation opportunities that we would like them most certainly to be participating in. This is no time for us as adults to be making decisions that quite frankly are irresponsible and are contributing to the spread through super spreader events like you had mentioned. We all need to do our part for a little while longer to see our way through this pandemic, and we should do it on behalf of the elderly in our community that are most susceptible to this virus, but we should also do it on behalf of the experience that we now see that our children aren't able to participate in. You have anything to add on that specifically, Doctor?
I mean, all I'll say is that the guidelines are designed that there's nothing zero risk, and every time you're outside in a public place, there is some risk. But if there's high compliance with the guidelines, that risk is low, and we can keep case numbers at a manageable level and even see a downward trend. If all of us don't comply, it just takes maybe 5-10% not complying, and that's what the modeling shows for the numbers to start surging upward. So I think, like the Premier said, it is really up on all of us. While enforcement and fines are important, I don't think we can rely just on that. It is really, I think, all of us as patrons, as business owners, need to relook at the guidelines. They've been updated with some minor tweaks today. It's really good to relook at them, irrespective if you've been running a business and know the guidelines, irrespective if you're a customer planning to go to a bar or restaurant or do other activity that's allowed. It's a great idea to look at the guidelines, make sure that we are complying as much as we can. And of course, we also need to do our personal risk assessment that, who do we live with, what's our personal risk, what is the risk of others in our household before engaging in such activities. But I think all of that collectively can still bring our case numbers down, as we've seen repeatedly in December and earlier as well. And I have to emphasize, like the Premier said, that while there's a lot of excitement about vaccination, vaccination won't start having an impact at the population level till the second quarter, later part of the second quarter, and we really have to comply with public health measures till that time.
Do you have a follow-up, Adam?
What was on the table? We've seen other provinces go for the curfew in Quebec. Ontario announced a stay-at-home order. We have Alberta has takeout only for restaurants. Were any of those or all of them on the table when you guys sat down and discussed what you were going to do today?
Well, in my view, all those options are, like, we keep a detailed tabulation of all the provincial measures, and obviously there's minor differences throughout from BC to Quebec. And we look at all of those. We look at then where are outbreaks happening, where do we think transmission is happening, and you can't highlight one single sector as, oh, if you do this, this will make a big difference. Low levels of transmission will happen as long as you have some sectors open with strong guidelines, but there'll be low levels of transmission. You can't, unless you do a full lockdown and stay in that for 6 weeks, 12 weeks, you can't, get extremely low levels of transmission, but then that has its own consequences. But, certainly there are indications that there's maybe less compliance with guidelines over the last, maybe week or two than there was in December, and that is concerning. And again, while enforcement is always an option, it is really just being familiar with the guidelines, remembering that we still are in a pandemic, and actually, and I've said that earlier, we saw our first true wave starting November, December, and now for the next 3 months, I think are for us in Saskatchewan, are our most critical 3 months yet, because our hospitalization ICU admissions are peaking. There's a 1 to 2 week lag between case numbers. So the high case numbers we saw over the last 3 days will impact likely on higher hospitalizations and ICU admissions a week or two from now. So I think those are all things we need to watch. We need to protect ourselves, our families, our communities, and the most vulnerable as the vaccination program keeps rolling up and gives that additional protection that ultimately will enable us to get out of the pandemic.
Did you consider any of those things?
What we would consider is the advice that Dr. Shahab provides us with, and much of the discussion over the course of the last while, understanding that our rates have been increasing since January, but we had some fairly positive, at least directional numbers throughout the month of December. Any discussions we had were very minimal with respect to changes from the status quo, and ultimately Dr. Shahab has recommended that we move forward with the status quo because it did work in December in lowering our rate of transmission, although he has not chosen to recommend to go to a 4-week interval until we consider what we would do next, but a 2-week interval, so that we can see what impact these restrictions will have in that post-holiday environment. It's our hope that they will start to bend that trajectory down and ultimately be as successful as they were in December. If they aren't, then I'm certain Dr. Shahab will be considering potentially some additional measures that may have to be introduced depending on what the challenge may be in 2 weeks.
We'll go to the phone lines for our next question. Operator?
We have Mary Mandrick with the Leader Post.
Good afternoon, Mr. Premier. Happy New Year. How are you following Dr. Shahab's advice to do all that you can? Can you explain to the public how not having more restrictions, not having more fines, not even threatening to tell people that they're going to be fined heavily is really doing all you can? Because I don't think there's a lot of people seeing it out there saying that you're doing all you can.
Well, I think the contrary is actually the case. There are a number of organizations and individuals that have been fined, up to and including throughout the holiday season, where we saw individuals that may be hosting home-based gatherings that were, any home-based gathering with people outside of your household is in violation. And we saw a number of fines that were administered in a number of communities across the province throughout that. So the fines are serious. I believe they're as serious as many other areas of Canada. A personal fine of I believe of about $2,000 and a corporate fine of about $12,000. And so public health and our law enforcement are using their discretion as to where they apply the investigation and ultimately the fine. So that is occurring. But as Dr. Shahab has mentioned many times, and I have as well, the goal is compliance. The goal is not to administer fines. However, they are being administered where people are blatantly ignoring the public health guidance that is in place. With respect to taking the advice and acting on the advice that Dr. Shahab provides, that's been the case throughout this pandemic. Yes, we've had discussions about the direction and the measures that are coming into place, but when Dr. Shahab has provided his advice to this government, we've acted on it.
Murray, do you have a follow-up?
I guess it's almost a question of the definition of insanity to keep doing things over and over again when they're not working, sir. And the numbers suggest that they're not working. We have the highest weekly case total that we've ever had. We've had the highest percentage of tests to positives that we ever had. I'm struggling to understand how you're suggesting that things are actually working and that we don't need more fines, that we don't need tougher restrictions, that we don't need to be doing a lot of things. How is doing things over and over again the same way we're doing it changing anything when things are actually getting worse?
The restrictions that we had in place, I believe we brought them in December 12th, if memory serves me correctly. We were, very fortunate in many ways throughout the month of December as those the measures that were in place were pushing our numbers down throughout December. In fact, we brought in a number of measures, I believe a week or 10 days before December 12th, that started to push down our rate of transmission in the province in the early weeks of December. On December the 12th, for example, the day that I believe we enacted the bulk of the measures that are in place, our 7-day average was 288 cases. 157 cases on December the 31st. So throughout the 3 weeks of that month, the measures that we have in place today will have proven to push our numbers down, push them down quite substantially. Yes, we've had a bump throughout January. We talked publicly about the fact that we would likely have an increase in our numbers post the holiday season, and that's exactly what we're seeing here now. If those numbers are to continue over the course of the next 2 weeks where they are or starting to increase, then you're right. I'm sure Dr. Shahab is going to come forward with a number of additional measures that will push those numbers down. But the definition of a plan that is working with minimal impact to the people in our communities and how they conduct their life, which is the goal, it is proven to work throughout the month of December. There's nothing telling me that in this post-holiday season that same plan shouldn't work. We've shortened the timeline for review of that, or Dr. Shahab has, and ultimately if it is not having the success that we saw in December, and then I'm sure Dr. Shahab will adjust that plan accordingly.
We'll take our next question in the room. Mark?
You say universal compliance is needed for these measures to work, and we didn't see that over the holidays. People gathered, case numbers are going up. How confident are you that we will see universal compliance and that these measures will work?
Well, I think in fairness, I'll just quickly say we did expect that there would be a bump in numbers post the holiday season. We didn't expect that it would be 100% universal compliance. However, we hoped for that. But we did see, with these very set of measures that were in place, a lowering of the rate of transmission in December. And we're hopeful that we'll see that same lowering in the couple of weeks ahead. So anything to add to that, Doctor?
Yeah. And, I think when we kind of look at what is the trend, when we look at our modeling data, like we've been looking at throughout October, November, December, and we look at potential projections, best case, moderate case, worst case, even towards the end of November and early December, we were very concerned. We were very concerned about unmanageable numbers over the holidays and higher rates of ICU admissions and hospitalizations. And then we put in some public health measures end November and then further restrictions mid-December. And actually, that had an impact because there's high level of compliance. And even during the holidays, I think most of us, and certainly most people, I'm sure all of us know, complied fully with the guidance, and that at least has had a significant impact. But in some cases people did not comply, and also over the last 2 weeks there's some evidence that in some, when you look at a particular sector, most businesses are in full compliance, but a few aren't, and there is follow-up happening when we become aware of those situations. But that is the point that, based on what we were seeing end November, early December, the outcomes are very positive for December. Now again, we are in a situation where the concern is rising, and where we will end up over the next 2 weeks, is again depends on actions we take today will have an impact next week and 2 weeks from now. And again, it's actually, if you were in contact of a case, obviously you have to isolate for 2 weeks. If you're symptomatic, seek testing, isolate till your test results come. If your test is positive, continue isolating, let public health know who your contacts are. If your test is negative, stay isolated till 48 hours without symptoms. Those are the tried and tested methods that keep numbers low. Wear masks when in public places at all times. So again, those are the measures that have worked in the past. They remain the same. It's just reminding all of us to comply with them.
Do you have a follow-up, Mark?
With the vaccination plan, we haven't seen quite the rollout that we were expecting early on. How confident are we that the timeline for phase 2 in April is still going to be met, and what needs to happen between now and then to make sure we meet that timeline?
So I have a great degree of confidence in the Saskatchewan Health Authority that they'll be able to meet and deliver the vaccines that we have delivered to us over the course of the first quarter of this year for sure, and thereafter. When we're in full vaccination mode of our flu vaccine, for example, as Dr. Shahab mentioned the other day, we have the ability to administer 80,000 vaccines a week. That's with the flu vaccine. The COVID vaccine, the Moderna and the Pfizer vaccines, have a significant larger challenge with respect to logistics and the temperature they need to be stored at. So I don't know that we could get to 80,000 a week with the COVID vaccine, but we most certainly would be able to deliver the couple 100,000 or the 190,000 vaccines that the federal government's going to provide us in the first 3 months. A little bit of a sluggish start, admittedly, and I mentioned as to 3 reasons why that might be. We had made a policy decision to hold back those 50% of those pilot vaccinations in the early days. That was on the advice provided to us from the federal government and the manufacturer. 2, we chose to go into our more rural and remote locations early, so that as we are in a case where we don't have or aren't delivering thousands of vaccines each and every day, we're able to focus our efforts in these more rural and remote locations. And now we have some opened guidelines with respect to being able to take the Pfizer vaccine out of, for example, the Regina General Hospital, take it directly into long-term care homes in the area and deliver it rather than bringing the long-term care residents into the hospital. So those 3 changes are going to help our capacity. Where we are today is we have about 10,000 vaccines that have been delivered. About 7,500 are in the freezer. We'll be expecting additional vaccines arriving this week. As I mentioned, will be between 30 and 32,000 vaccines that will be delivered here in January to the province, and we will have those, for all intents and purposes, delivered by the end of the month or in the first few days of February before our next delivery does arrive. You're going to see the vaccines remain in that area of 1,000 for the next few days and then start to increase again, ultimately with the goal of getting up to about 2,000 by the time we get into February. We'll receive 60,000 doses at least of vaccine in February. Stands to reason with 28 days in February, we need to be a little bit above 2,000 per day during February. You're going to see the Saskatchewan Health Authority get up to that level, get their 30 to 32,000 into Saskatchewan people's arms in January, and have 60,000 at least doses delivered through the month of February. So the capacity that we have in our public health delivery system across the province that is shown each and every day in the flu vaccinations, I'm very confident that we will be able to deliver the vaccines that will be made available to us in the first quarter and be able to deliver the vaccines that will be delivered to us post the first quarter. Have anything to add on that? You're the guru on vaccines.
Yeah, no, I'll just say that once we enter the more mass vaccination stage in April onwards, then you don't really have to sequence by specific groups, and it's open to a broader section of the population, so the vaccine pace does pick up. But right now, I think we have to recognize that right now it's the eligibility is very specific healthcare workers, very specific residents of Saskatchewan, residents of long-term care, personal care homes, persons over 80 throughout Saskatchewan. So the vaccine has to make its way with all the complicated logistics of Pfizer and Moderna throughout Saskatchewan. So that's where it's making its way. It is slow because of the fact that small amounts have to go ultimately in January and February to every small community in Saskatchewan to get the groups that are first in the sequence. So that's why it's slow, but it is essential that people who are most vulnerable are covered first. But then, of course, as more vaccine comes and the eligibility groups become bigger, the pace picks up, because then it's more of a broad mass immunization clinics like we see for flu. The numbers really pick up.
Our ability to remove the Pfizer vaccine out of the where it's delivered will be tremendous in allowing our public health workers to get into, first of all, long-term care settings, but then also other settings in and around our larger centers in the province. So, the last 5 days, I think our average is about 1,009 vaccines a day. You're going to see that increase in the days ahead as we head towards the end of January, ultimately with very close, if not about 30,000 vaccines delivered by the end of the month, and at a pace where we will be at a pace that will allow us to look at the 60,000 plus that we'll be receiving in February and delivering them that month as well. So I'm very confident in our public health care system and the staff throughout the province that know how to do this and know how to do it very well.
We'll continue in the room here. Steph?
Yeah. Mr. Premier, how come you're citing testing numbers from December 31st when your Chief Medical Health Officer admits that throughout the holidays the numbers were quite low? So that could actually skew how effective these health measures were. So is there not a sense on your part that perhaps you think these public health orders introduced December 17th were working, they weren't working as well as you maybe thought they did because the testing numbers were simply low?
No, that's a good question, and I should clarify. When I said December 31st, that was a 7-day average on December 31st and a 7-day average on December the 12th. So it'd be the running 7 days up to and including that particular day. December 12th, our 7-day average of new cases was 288, and on December the 31st, it was 157. It had you may be right. During the Christmas season, there may be a little bit of the testing numbers that moved those numbers, but they consistently declined virtually throughout the month of December, and virtually since late November when we started to introduce additional measures that remain in place today. So, we feel very positive that the measures that we have that are significant do have an impact on the spread of COVID in our communities. However, if they prove not to be as effective over the course of the next 2 weeks post this Christmas holiday, I'm sure Dr. Shahab may be coming forward with some recommendations that would change those measures and quite likely add to them. If they do prove to be as effective as they did in December, I would be hopeful that we'd be able to carry on as we are for some period of time.
Follow-up?
Just on that last point there, so do you see a scenario where you could relax any of these existing measures come the end of the month? Because we talked about the possibility of adding on to them, but do you see a scenario where maybe cases have leveled off enough that you can start to actually loosen some of these, or is that really not on the table?
So I'll turn that over to Dr. Shahab very quickly, as it ultimately would be his recommendation, but I would say that this is too early for us to tell. If we're able to start to push our numbers down, Dr. Shahab would make a recommendation at the end of the month and likely 2 or 4 weeks later than that. But I would say this, and Dr. Shahab and I have discussed this, if there is a measure that we would like to have a look at, and I don't know that we would be able to have a look at it by the end of the month. We may be having a much different conversation if these numbers continue to rise. But if there is a measure that I hear about and that I would like to expand, not greatly, but slightly, would be us keeping in our single households. That is a tough one for families. It's a tough one for extended families, for grandparents. Excuse me. But I don't know that we'll be there at the end of the month, and I don't know when we'll be there. But that's a measure that we have discussed.
Yeah, I mean, the trajectory mid-December certainly had us thinking that maybe if we keep on the trajectory that we saw in mid-December, downward trend, that we would be able to, as the Premier said, go back to our 27th November situation by mid-January, which would have been allowing up to 2 or 3 households. But, that did not happen. We saw a further dip in holidays that was artifactual because, and we saw all the other provinces saw that. Testing numbers dipped. And we knew this is an artifact, this is not the truth. What we saw in mid-December was the true situation, a bit of an artifact over the holidays. And then we held our breath, as schools restarted, people went back to work. It looked fine for a bit, but then it picked up quite concerningly. And definitely right now, we definitely have to see a downward trend which is sustained. I've always said, below 200 is important for the medium to long term. Then you can start looking at relaxing numbers. And this is going to be very important. And again, while the numbers seem very daunting, we saw in December, actually, I was surprised by how quickly this starts going downwards with the measures we have in place. So while the numbers seem daunting, it is really up to all of us. And if all of us just change our behavior slightly and put that extra care in our day-to-day actions, that has a profound effect on numbers. And we've seen that repeatedly in the past.
We'll take our final question from the phone lines. Operator?
We have Lisa Schick with CJME.
Hi, I was hoping both the Premier and Dr. Shahab could answer this. In December, you talk about the numbers were going down, going in the right direction, and then now we're seeing higher numbers, in some cases record numbers, almost proving that people didn't follow the recommendations and kind of the pleas that you guys are putting out for them to follow the health guidelines. How frustrating is it to see these numbers now?
I don't know that I would say that it means that a large number of people weren't following the recommendations. I'm sure there was some that weren't. But even with the current recommendations that are in place, whether it's an outside gathering of 10 individuals or going to various establishments or being out and about in any way, there still is a risk of contracting COVID. Over the Christmas season, there may have been a larger number of gatherings that were in the recommendations that we have where transmission did occur, but there was a larger number of gatherings, and that may have been part of it. But I'm sure there is a number of individuals that did stretch or actually operate outside of the recommendations that were there. We had anticipated that there would be a bump in the numbers post-Christmas, and unfortunately we were correct with that, or Dr. Shahab was correct with that. But do you have any comment on that, Doctor?
Yeah, and I'm just looking at our daily case numbers on the website, and our first true wave starting, by kind of really picking up speed like by mid-November, but it is a seesaw pattern. And I think, we are a province with a large geography. Some of the dynamics are very different in different parts of the province. But, it is a province where, our individual actions done by everyone, we respond very quickly and favorably to getting numbers down. And I think we need to remember that. I think very large urban centers have their own challenges, and I think we are blessed with the opportunity to be outdoors as much as we want with the mild weather. A lot of our indoor public spaces allow for physical distancing, in a safe manner. A lot of our retail locations with the new guidelines allow for us to shop in a responsible, safe manner. But we just need to then comply, because I think we are blessed with many opportunities to keep our numbers low. But it does take a high level of compliance, and I think that is something that we need to take to heart, because we've seen that in December, that with the same context, our numbers did reverse. And again, right now, this really is an opportunity for us to, our average contacts per case are low, 3 to 4. So that's something that's very important. So our contacts have not gone through the roof. So I think, we have been, for the most part, on the right track. There's been some lack of compliance resulting in a bit of a jump. But I think we still have a critical 1 to 2 week period of time to turn things around, just like we did in December. But we all have to think through, what do we do on a day-to-day basis, that maybe we need to just do something a bit more carefully or a bit more thoughtfully.
Follow-up, Lisa?
Yes, just on the vaccine plan, how far ahead is the plan progressing? Like, how far ahead are you deciding where these vaccine doses are going to go? Like, is it a few days before you get them? Are we talking weeks ahead? And what kind of a communication is there with the places that are getting the long-term care homes or the hospitals? Again, is it weeks ahead or is it days ahead that they're finding out?
Yeah, thanks. And, I'll make a few comments and then Mr. Scott Livingston may also want to add. But, one thing that is becoming more and more firmed up over the last week or two is that we know that there's a set allocation date for Pfizer and Moderna, and now it's online as well, that everyone can see allocations by province. And then, of course, there's the capacity to receive at hubs and redistribute locally. That's strengthening. So, and then, of course, we know that, which parts of the province have more activity, COVID activity, so there's a bit of a alignment with, vaccine supplies, initially at least being aligned to those areas, but also recognizing that for the tight sequence that we initially have, long-term care residents, personal care homes, persons over 80, we do want everyone in the province to be able to be covered by vaccination in a reasonable period of time over January, February. So it is multiple things that come into play here. But it is challenging, and initially with small amounts of vaccine that have to be distributed over large geography, it is extremely challenging, and the special handling of vaccines that are required, even with the new possibilities of distribution, it is again vaccines that require very careful handling. And I'll maybe see if Mr. Livingston has any further comments.
So the only thing I would add to what Dr. Shahab has said is the plan for vaccination province-wide, including both phases, is to make sure that we are ready, the system is ready, and immunization ready with 24 hours notice across the province. So not just looking at what we're getting for vaccine over the next 30 days, but looking at how many people do we need to vaccinate or plan to vaccinate and offer vaccinations to up until September of this year, where everybody should be offered a vaccine that wants one, and then planning backwards from that. So it doesn't matter what they're sending us, we'll be ready to deliver, and will be delivered using the infrastructure that we have and that we're building. So again, the focus is ensuring that the province is immunization ready at all times, regardless of what's coming down the pipe for vaccine.
I'll just close with Scott and his team are, doing what I would say is a remarkable job at getting up to speed as quickly as possible with something that we really haven't done before in this province or done before anywhere across the nation. Yes, we do our flu vaccinations each and every year, and we do them very well, and we have very high participation rates here in Saskatchewan. But the logistics of the COVID vaccine, in particular the logistics of the COVID vaccine, when half of our population is not in a large urban centre, half of Saskatchewan's population is in a rural centre, and a number of those individuals are in a remote centre as well. Does add some level of complications to the early stages of this. In saying that, I'm very confident in the days ahead. Scott has been working very hard with his and Dr. Shahab with the public health teams across the province to ensure, as per your question, Lisa, that our communication is always improving as that we receive the vaccines into our central hubs and then disperse them out from those central hubs to the smaller communities, and we're getting better at that each and every day. And I would say that the days ahead, we're going to see some significant increases in our daily vaccination rates. On our first minister's call last week, we also, across the provinces, had asked the federal government to improve their communication with the provinces as well, to ensure that we can have two questions answered, is how much vaccine are we getting, when are we getting it, and where is it coming to? We do have the where, I think, fairly well spelled out from the federal government, but the when, as per what day, has been somewhat challenging in getting that type of clarification, and even the how much vaccine at times has been somewhat challenging. So we've asked the federal government to up their game with respect to communication, and I think in fairness, the Saskatchewan Health Authority, Scott and his team have have most certainly, over the course of the last number of days, have been increasing their communication ability between our facilities, and in particular between those facilities that are receiving the vaccine and then ultimately the facilities where the vaccine is landing. So very confident in what's been happening in the last number of days and what is going to be happening in the next number of days here in Saskatchewan on the vaccination front.
Thank you, everyone. That concludes today's update.
Thank you.